Chair. This is our second report and we're waiting on a third report. And this second report, we're told that the percentages of the pelvic procedures carried out not reaching the criteria are so high that a further inquiry is mandated. And you're going to do that now in relation to look back at all of the patients, and I welcome that. And then we look at what the percentages were, and I think we can't repeat them often enough, that the Children's Hospital Temple Street, 60% didn't, and 79% of Cappagh did not meet the clinical indication. So operations carried out at that high percentage that weren't necessary. And so in my short time, Minister, I welcome the changes you're making, but I want to zone in on the board of CHI, and I recognise that they're there with no remuneration. And it's a whole, actually, model that we need to look at. And I believe hospitals should be run by the health executive. And that board has been there for a very long time and put on a statutory footing in 19, on a statutory footing. There's been a huge turnover of directors, actually. And we had them before us on the public accounts on Thursday. And I take a lot of the blame myself, our inability to ask questions in a tiny space of time. But I was singularly unimpressed with what came before us at the public accounts. And you might look at it. So we had a new CEO who knew nothing about anything except to tell us that the previous settlement in relation to the settlement in relation to the previous CEO was confidential, but that CEO had a new name, same salary, and nothing else. That CHI board also presided over $250,000 that they failed to collect from private insurances. And that Children's Health Ireland board was before us without a chairperson and without a single member of the board before us to account for anything. And then I'll finally finish on this in my short time. They refer to a report every year or an internal review carried out by external people, but they couldn't tell us anything about that because that was simply for them to learn. Now you seem to have got one of those lately, but one is carried out every single year. They tell us in the financial statements to assure them that governance is, to me, I received no assurance. I'll stop.
Thank you, Deputy.